Live from the French Quarter, this is Eyewitness Morning News.
Right now we're at 8:16. When most of us talk about growing older, a lot of times you think that sometimes the sexual intimacy becomes a lot less frequent. That may not be the case with a lot of people. We're seeing more and more problems with seniors and sexually transmitted diseases. Here with more on that and how to stay safe if you're a senior and are sexually active is Dr. Neil Baum, People's Health Urologist. First of all, there are a lot of myths associated with growing older and the subject of sex.
Well, one of the myths is that as you grow older, it doesn't become an issue, and nothing could be farther from the truth. Older people enjoy intimacy just as much as you and I do.
And although we're on the way there, but let's go over some of the misconceptions. Number one, seniors lack interest in intimacy. That's a first big misconception.
Huge misconception. Intimacy for a senior is not always having intercourse. For a senior, it might be holding hands. It might be touching. It might be kissing.
Even for younger people, it's the same way. I mean, the intimacy goes, intimacy can be a lot of different forms.
Well, as we get older, we still like to have closeness.
Sure.
And closeness involves intimacy. And intimacy often can lead to sexual activity. So seniors are sexually active and would like to be sexually active if possible.
And that goes into our second misconception: seniors can't perform sexually.
Absolutely they can, but things are a little different. A woman may have decreased estrogen, she may have vaginal dryness, making things difficult. A man may have low testosterone, and it may affect his libido. A man may have erectile dysfunction or impotence, making it difficult for him to get an erection. So things are going to be a little different, but they are going to be able to be successful.
And the third misconception, it seems like almost you wouldn't even believe this, that sexual dysfunction is untreatable. You see the commercials for all kinds of stuff on the airwaves all the time.
Most people, including seniors, can find help. There are medications they can use. There are different positions they can be instructed in to engage in sexual intimacy. So for the most part, they can be helped.
And does illness or a disability affect a person's sexual
performance?
Performance, yes, thank you.
Yeah, for certainly it does, because an older person may have heart disease, and they may fear that they're going to have a heart attack.
Okay.
But the truth is that if you are engaging with the same partner, in monogamy, the likelihood of having a heart attack, a stroke is absolutely negligible. So that's a real plus for monogamy.
And if we can talk about the other side of monogamy, people who are very sexually active as seniors, we are seeing a rise in seniors with STDs.
They are not immune for getting an STD, sexually transmitted infection. They can get gonorrhea, they can get syphilis, and they can even get AIDS. The number of people, older people who are getting AIDS is doubling. So these people need, if they're having a new partner, need to be tested, and the man needs to use a condom until they are tested.
All right, Dr. Baum, thank you very much. If you'd like to learn more about taking care of your sexual health as a senior citizen, you can call the People's Health Network at 1-800-978-9765, or we have a link to that on our website at WWL-TV.com. Anyway, the number for People's Health right on the screen there, that 1-800 number, a toll-free number, or you can go to our website, WWL-TV.com.